Hi everybody, thank you for those of you who've joined us so far for our EMIS Health Live Understanding GP Connect session. So we've got Nathan Howard and Catherine Hoyle on the line, who Nathan's going to be taking us through a slide deck to explaining GP Connect and how you can make the most of that. And then we've got Catherine on the line as well, who's going to be able to help answer questions. The session's going to be recorded and we'll be sharing that after the event. If you've got any questions, you should have a Q&A box. So it's two little speech bubbles with a question mark in it. If you click on that, you should be able to ask questions. Ask them as we go along, we'll save them up, and then we'll try and get through as many of those at the end as we can. If we don't get to your question, we'll be pulling together an FAQ or Q&A at the end that will be sent out after the event, so don't worry if we don't get to your question. But thanks for joining us. I will now hand over to Nathan to take you through the presentation.
Good afternoon, everybody. My name's Nathan Howard. I'm a training optimization consultant for EMIS, and we're going to be looking at understanding GP Connect today. So what we're going to look at today, we're going to look at what GP Connect is, how it works, the capabilities and the future functionality of GP Connect. We're going to look at requesting GP Connect, the sharing agreements pre and post COVID. And then in terms of COVID-19, we're going to look at the CCAS service and how that works, as well as the enhancements that have been made due to COVID. We're going to look at the configuration within EMIS Web, so the organisation configuration, appointments, and accessing how to access the HTML view. And then we're going to look at the future functionality in terms of messaging, sending and receiving documents. Okay. So what is GP Connect? It is a national interoperability platform that we are working on with NHS Digital. GP Connect joins together various clinical systems through the spine so that healthcare providers across all settings have access to invaluable primary care data. So it's an NHS Digital platform. It's opening up patient data held within GP IT systems for use across the health and social care organisations. Appointment management, which will allow organisations to share and manage their appointments to support joined up patient care. GP Connect is a service that will allow GP practices and authorised clinical staff to share and view GP practice clinical information and data between IT systems quickly and efficiently. It makes patient information recorded in EMIS available to providers using the TPP clinical system and vice versa. GP Connect team is currently working with Vision and Microtest to enable the functionality on their clinical systems also. It will allow clinicians to share tasks and book appointments across systems so that they can work more closely no matter where they are located and what system they are using. The service will make patient medical information available to clinicians when and where they need it, leading to improvements in healthcare they are able to provide. So how does it work? It works, GP Connect works using fast health interoperability resources, or FHIR, to flow messages via the spine. The FHIR is an industry standard for passing healthcare between IT systems. And the current capabilities of GP Connect are, we've got the GP record HTML view. This allows access to the patient's care record in HTML view form, which allows clinicians from a third party, so another clinical system, to view a read-only version of the patient's detailed GP practice record. You can also use the appointment book, so appointments, publishing of appointment slots to be made available to other healthcare providers that may be using another clinical system. Viewing, booking and cancelling appointments at other organisations also. So an organisation can publish appointment slots to be made maybe a local hub or an enterprise. That may be using another clinical system. So they are a provider organisation with the provider of appointments. Other organisations can then book, view and cancel appointments shared across the local hub, local network, and they are the consuming organisation. GPs, as an example, GPs can be a provider and also consumers. They are able to provide GP Connect appointments, but may also view, book or cancel appointments at other organisations. In terms of future functionality, we've currently got a pilot stage access to GP structured record. It allows the consuming system to import and process patient data in whatever way it requires to best support patients and the healthcare professionals treating them. So, as an example, a patient is admitted into an acute hospital trust. As part of the admission, a full set of the patient's current medication and allergy information is retrieved from the patient's GP record and imported into the hospital system. By sending the clinical data in a structured format, the local system can import the data, reducing the level of data entry required by the local clinician. We're also piloting messaging, so sending and receiving, and we'll talk a bit more about that later. But it's as an example, it could be extended hours. It supports consultations booked via GP Connect appointments held at another organisation by sending or receiving a summary of the encounter in PDF form back to the patient's registered GP practice. So we're just going to have a little look at how it is requested. So pre-COVID, pre-COVID-19, the GP Connect was requested. A commissioning organisation, so a CCG, would implement a GP Connect functionality on behalf of a sharing group. A sharing group consists of multiple organisations who work together collectively to make use of one or more of the GP Connect capabilities for direct patient care. And a local sharing group agreement would be deployed by NHS Digital for that sharing group for both provider organisations who hold the patient record and the consumer organisations who view the data. But since COVID has come in, NHS Digital was issued with a notice by the Secretary of State to create a single national sharing agreement on the spine for all practices in England until September 2020. The notice allows NHS Digital to share patient information with organisations entitled to process the patient data for COVID-19 purposes. In EMIS Web, we ran a process to activate GP Connect for all practices in England. So if any of you from practices, you would, if you were to go into organisation config, you would see that it would be pre-ticked within the organisation configuration and GP Connect configuration. So what this meant in terms of it being activated, it was activated by us by a process. We enabled enabled the tick boxes automatically. Prior to this, none of the tick boxes would have been ticked, and each organisation would have had to manually select them on the screen. So with GP Connect and COVID-19, NHS in England launched a branch of the NHS 111 service to solely deal with the COVID-19 pandemic. This service is called the COVID Clinical Assessment Service, or CCAS, as many of you may know it. This service uses GP Connect to communicate with all practices over the country. So how the service works, the patient will call the normal NHS 111 service. If the patient is then diagnosed or have suspected COVID-19, they will be passed over to CCAS. There the patient will be assessed on how severe their symptoms are, and the CCAS team can access the patient's records to help with this assessment. So using GP Connect HTML view, the CCAS clinicians can see a read-only view of patients' records. Then, if required, they would book an appointment using the GP Connect appointments functionality, book a telephone slot into the local hub or GP practice for a primary assessment. In terms of the appointment book, GP practices and hubs were required to create a daily appointment session within their appointment book. The NHS digital guidance for practices setting up the CCAS sessions has been changing roughly on a weekly basis, so it does change, it has been changing quite regularly. So currently we've got some hubs that are keeping daily session exclusivity for COVID-19 patient slots, but then there's others that mix the CCAS slots with regular NHS 111 slots in the same session. The prerequisites required to configure CCAS sessions are the organisation needs an ODS code. This is provided by NHS Digital. The organisation must have a spine connectivity and patients must have been synchronised with the spine. We have advised, from EMIS, we have advised to create a new dummy practitioner session holder exclusively for the CCAS NHS 111 slots. And if you see on the right hand side of the screen there, those are the roles that are required for those sessions to be able to be booked in for them. They also need to be a session holder and a consultant. And finally, it's recommended that you can maybe create a new telephone slot type, so it's easy to search when you're searching for through your appointment book. The enhancements that we put in place for COVID-19. So searching for GP Connect appointments, the slot type is now displayed within the session name. So previously it was just the session name that appeared on the right hand side, but now in brackets you have the actual name of the slot type. And also we've changed the HTML view around so that the most recent COVID-19 codes appear as emergency codes at the top on the summary screen. So this can be used in future if there's any other pandemics or anything like that. We're able to move the data to a better place within the GP Connect HTML view. So moving on to from CCAS, we're going to look at the GP Connect configuration and what's required in EMIS Web to allow it to function. As I've mentioned before about turning it on within organisation config. Now, a majority of you will have it turned on, but maybe you're a clinical service that hasn't yet had it switched on yet. You would need to go into your organisation config and then edit the organisation, and you should see the GP Connect configuration option on the left hand side. This one is an example of one that's already been activated, but if it's not been activated, you will see that the tick's not there and all the other ones are greyed out. So it's a sort of hierarchy structure. So if I was to have GP Connect ticked and HTML views ticked and structure view tick, I wouldn't be able to use appointments because foundation needs to be ticked before I select appointments. Following that, the organisations can be grouped together and used to filter appointment sessions, so that only certain organisations can use slots in a session. Organisation groups allow you to create groups of organisations that you either wish to restrict GP Connect appointment slots for, or search across their organisation appointments. So organisation groups can be used to build up groups that represent your local GP federation or a particular service that you have an arrangement with to provide appointments. Once an organisation group is created, by one organisation, it can be seen and used by other organisations that are part of that group. In order to add the group, we need to go to the organisation group buttons, organisation groups within organisation config, and then we would need to select the add button at the top left of the screen. We then need to name the group appropriately, and it has to be a unique name as all the groups are global. So these are global groups. So make it a unique name. By selecting the magnifying glass on the organisation sections, you're able to search the organisations by NACS code or ODS code, and then you can add them in to that group. Once you've added that group in, you may need to subscribe to it, or other organisations may need to subscribe to it. So in order to subscribe to it, you need to go onto that organisation groups page, and at the top we have an icon that says subscribe organisation group. You highlight the organisation group that you want to subscribe to, and then click that button and it'll go into your subscribed. You need to do this in order for it to appear within your appointments module when you are searching for appointment slots or creating sessions for a GP Connect bookable. And moving on to appointments and creating those slots and those sessions. When creating a session, individual slots can be made available for GP Connect. Alternatively, the whole session can be made available. So when creating the session, you'll see the option for all slots GP Connect bookable. That's highlighted there. The set all option will be greyed out until the clinician and the appropriate role is selected. So once you've named that last part would be to do the GP Connect bookable. You'd name your session, you'd create a session as you regularly would, and then you would set the clinician at the bottom of the screen. Once they are selected, the set all option becomes available to you. And just to reiterate, on the right-hand side, bottom right-hand side there, those are the roles that are required in order to make a GP Connect bookable session. When they are selected as GP bookable, you'll see the globe icon on the left-hand side of the session preview, or when they're in the appointment book. So that's how you know that they are a GP bookable slot. But you can also just make like individual slots GP Connect bookable, and to do that, you would just on the preview, you would highlight the slots you're wanting to make bookable, right click on them and go to your properties, and at the bottom you'll see a tick box for GP Connect bookable, and you can tick that box. You may also want to add session filters. So session filters allow you to restrict your GP Connect appointments to ensure that they are only offered to the practices you want. This allows you to filter out slots by either reserving or limiting a specific organisation group, an organisation type, or a specific organisation in appointment sessions. So to do that, you would select the Apply Filter option. And within there, you have a box. You can add in several filters. At the bottom left of that box, you'll see it says Add Filter. You can add in as many filters as you want. At the top, you see it says this session has 6 slots, so it tells you how many slots there are. The filter type has 3 options in it. You have the organisation type, so the type of organisation you're wanting to filter. So this can either be GP practice or urgent care. The second option is organisation group, which is what we were looking at previously when we were setting those up. So you can select the group that you wish to filter using the magnifying glass under name when that appears. So that would appear there. And you would also you can also just do a specific organisation and search for them with NACS code. Below that, you have 2 options. You've got number of slots and kind. Number of slots. number of slots enables you to select how many of the slots will be available for this particular organisation group or organisation type or individual organisation. And the kind option is whether you want to limit or reserve these slots. So if we just in terms of limiting will set a limit on the amount of slots that this organisation can book within that session. Once that limit is reached, the booking organisation would not be able to see the slots when searching for them through Find a Slot. Reserving will reserve the defined number of slots exclusively for an organisation to access. Once the number of reserved slots is reached, all the slots will be available to the other organisations. The majority of your setups are going to be that all slots will be available. So that you'll make, but it could be that you have 3 slots available for a certain service. You are able to edit the filters after the session has been created by accessing the slot session properties within the appointment book. So in terms of booking the GP Connect, so we've now created our sessions. If I was on another system, or if I was trying to book into maybe a system 1 appointment book, these sessions are built so they're available to be booked into. Within the within the appointment book, you would click on Find Slot at the top left, and then click on Find GP Connect Appointments, and then this screen here that we see here, the Find GP Connect Appointments screen is displayed. Once a patient and organisation group have been selected, you will see the available slots appear below. Only organisations that you are subscribed to will be displayed. In terms of booking, you would highlight the slot and click Book, and you're greeted with the book slot screen where you can put in a description and a comment into there. Following that, once you click Book, you'll get the appointment booking confirmation. But it may be that you want to amend or cancel an appointment. So to find a booked appointment, you would need to click on Patient Appointments and then select GP Connect Patient Appointments. The patient appointments that are booked through GP Connect screen is shown on the screen. So you can see the future and cancelled appointments above. Again, you have to select the organisation group and the patient on there. Selecting as I said, selecting the group and patient will return the result of future appointments and cancelled appointments. And then I can right click on that slot and on the appointment within future appointments, and that will allow me to amend the description and the comment within there if I needed to. You're also able to right click on and cancel any future appointments, and it will also prompt for a reason. As well as this box that will appear. So the appointment's been cancelled, you'll also have a reason for cancellation, as you regularly would if you are using EMIS for booking appointments and cancelling. So moving on to the HTML view, so viewing patient records using GP Connect. A HTML read view only of a patient's GP record is available to other clinical IT systems. Each time the clinician accesses the record, they must gain the patient's consent to view it. So once you go in and access it, there'll be a consent box. You have to click yes or no for patient consent. To load the GP Connect record, you must access through the shared record panel within the patient's care record. So the patient from another, if the patient's from another organisation, they are required to be registered as a temporary patient in EMIS Web, so that the clinician can view the patient's shared record. This is currently used for things like COVID hot and cold clinics and hubs. When the consent is confirmed, it opens up into the GP Connect tab. So a new tab becomes available within EMIS Web's care record. And as with the other modules within EMIS's care record, you'll have options along the ribbon along the top. That gives you access to different parts of the shared record. These are standard across all of the sites that are using GP Connect. So all of the systems that are using GP Connect will be using the same headings. So you've got things like problems, medication. And you also find that these sections are, like I said, standardized across all GP Connect clinical systems, and it's a static view of the record. However, in some areas, such as the medication screen, we will be able to filter by date. If you see along the top there, you can see filter by date range. So future functionality, sending GP Connect messages. So external patients that have been booked via a GP Connect appointment will become a GP Connect registration type patient and allows messages to be sent back to their registered practice. So if a patient is a GP Connect registered registration type, the Précis bar will be purple. Any consultation created for a GP Connect booked patient after a GP Connect booked appointment has been attended, a message will be generated and sent to their registered practice. You can view the message after it has been sent from the consultation or from the documents in care record. Once the message has been sent, a task will be created in Workflow Manager, so you can see that within your sent tasks. You will also be able to amend the consultation, what's being sent, up to, I think it's 2 or 3 hours after the consultation has taken place. So if you needed to go back in and amend that, you would be able to, and that would then amend that message that is going to be sent off. When a message has been sent to your practice, so this is in terms of when you're receiving those GP Connect messages, so when that's coming back for a GP Connect appointment, the message will be displayed in Document Management within Workflow Manager. You can view the message by selecting the Documents tab on the bottom pane, as you can see there, that's highlighted in red, or the Document Attachments tab, which is a couple of options along from that. And then you can view the report there. That's roughly what it would look like. So thank you very much. I'm going to pass it on for any questions to Catherine.
Thank you, Nathan. So we're going to just answer some of the questions that we've had in. So I'm just going to ask this on to Nathan. So one of the questions we've had on our list, we've got, let me just read it. So we've got, why are CCAS booking GP appointments for patients with COVID symptoms?
Why are they?
Yep.
So because it's the new NHS 111 service. So COVID-19 clinical assessment service, that they'll assess it, and they will be then using the GP Connect functionality in order to book it in. It enables them to get treatment if they need, or a telephone triage or a telephone consultation. So the CCAS should be booking into telephone consultations, not face to face, if it's a COVID clinic.
Thank you. So let me just see if we've got some more. So one question, we are going to publish some of these questions. So we've already got one published. Oh, sorry, that's about the slides. So any slides will be circulated after the event. Let's see what questions we have. So we've got one for, is across organisation appointments available outside of the NHS and CCAS stuff that are implemented for COVID? So these appointments that have been set out for the GP Connect for the CCAS and COVID are implemented within GP Connect. Anything outside of that, so if you were looking towards a hub facility or an enterprise between a number of practices and you want cross-organisation there, it is something that as a sharing agreement you will need to be set up between yourselves and have that cross-organisation functionality. So it is separate to GP Connect for that part of it. Let me just see a few. We're having a few more as we're going, so I'm just trying to read these questions. Please bear with. So we've got one for, how does this work with EMIS community and the data sharing agreements that already exist within the community modules? Is this also a solution for PCN level working when practices group together? So again, that's similar to the previous question. This isn't currently in use with EMIS community at the moment. It is primary care. But if you're wanting to use this as a PCN level working and practices working together, again, that is something that would need to be agreed between the practices within sharing agreements, and everybody, each organisation will need to accept the sharing agreements, and then you can have the cross-organisation appointment functionality bolted onto the EMIS.
Yeah, and in terms of GP Connect, if you have some sites that are System 1 practices, as long as the let's say the hub has a ODS code, like a correct ODS code, you should be able to set that up on there.
So we've got another one. So we've got included, well, along with that questions, we've got, so we could set up EMIS, TPP, Microtest and Vision to book into each other's extended access clinics, for example. I'm guessing that's for the hub.
You could do, again, it would need, if it was going to a hub, you would need it to be a clinical service with an ODS code, and that would need to be set up. And in terms of Vision, Microtest, they are currently working on the GP Connect functionality. So as far as I'm aware, it isn't available for those at the moment. At the moment, it is just System 1 and EMIS that are using this. But in the future, it's anticipated that Vision and Microtest will be joining this as well.
Perfect, thank you. So we've got another question for, is it EPS enabled, i.e. can we send prescriptions to the pharmacy?
No, I don't believe so. Although, no, it should be, because it would go under your, I'd have to look into that. So if we can leave that for the FAQ, yep, I believe so, but it would go under your cost center, wherever you're being, wherever the patient's being seen. That's why we need the ODS codes within there.
No problem. Okay, so is there a particular reason why we have to add a session holder to the session template to enable GP Connect? We use generic templates and it will be more work to amend our current session templates. Currently with Black Pear solution, we don't have to add a session holder to enable 111 bookings.
The reason is because it needs to be someone with that. The appointments need to be booked in with the GP Connect appointments need to be booked in with someone with the roles that I displayed earlier. So you could technically, have a session and that doesn't have a session holder there, and then add a session holder that wasn't one of those roles, but that wouldn't let it make it GP Connect bookable. It has to be one of those roles. So you do. There's no. I don't think there's a way around it. You will need, in order to enable it within that screen, it'll just be grayed out. Otherwise, you'll need to select the session holder at the bottom. You can always amend the session holder as well, or do it for multiple.
No problem. Is GP Connect completely separate from just viewing data from, say, EMIS and System 1, no appointment booked, but would like to see community services data in our area, most of whom are System 1? So GP Connect will just be the registered GP practice data, as opposed to the community services. So if the practice have had something back from their community services and added it to their registered patient record, then you would be able to see that data, but it won't connect to anything community based if it's not been added onto the registered GP record. Why, where does the temporary patient need to be registered? That would be the registered temporary patient would need to be registered at the organisation that's going to deliver the appointment.
Mm-hmm.
And this is for the System 1 or Vision sites.
Yeah. So if someone was booking into if you were wanting to view the HTML record, the only way of accessing that patient is to register them as a temporary patient. If you don't do that, where's that information going to get stored? Because the information that you input into, or if you were to input data, so if you were to see them for a session, you'd have to put that information onto your system. So it wouldn't go back. The only way it would go back would be through the documents messaging. So the reason that patients need to be registered as temporary patients is so that that's the only way of accessing that patient through GP Connect, because it's through the sharing navigator within the care record.
Thank you. So we got, how do we book external appointments again, please? Can you get back to that slide?
Yeah, I can zoom back through, I think, external appointments. What was the question? Sorry, how do you
book the external appointments again?
So if you're familiar, if you have any sharing agreements where you currently do cross-organisation appointments within the appointment book, so you would be in your appointment book. Ideally, you'd have the patient selected on the Précis bar. You'd have them already loaded up. If you go to the top left-hand side of the screen, you have the find slot option, and as long as you've set up the subscribe to the organisation group, if you click on the bottom half of that button, you'll have a drop-down menu, and it'll say find GP Connect patient appointments. That's not the right one. Sorry, it's this one. So yeah, so it would be on. Oh, it's now frozen on me. I'll find it now. Yeah, so within appointments, you would then within there you would then search for the organisation you're wanting to book into, or the organisation group, and then let's see if we can find it. Oh yeah, booking was the same one. So yeah, so the patient would be selected at the top. So when you click on that, find a GP Connect appointments, this box would appear. If you've already got the patient selected, then they'll already be in that box. If not, you'll just have to do a little patient search for them. So you just search for the patient, and then below that you would select organisation group. So those are the groups that we were setting up initially, and then you do a search from and to date. and then the available appointments would show up below that. So as you can see there, we've put in the organisation group, and below that are the available appointments for that group.
Perfect, thank you. So I've had another one say, can we remind everybody that the GP Connect information is all on EMIS now? So yes, we have got all our information up to date on EMIS now. If you are familiar with our EMIS Now website. If not, if you go on to search for EMIS Now, and you will get this search box on EMIS Now that you can look for GP Connect, and there's all different GP Connect information on there. Also, we've got another one. NHSD advised that 111 slots are spread throughout the day, but a lot of practices only want to offer 5 appointments when creating a rota for 111. How do they spread these across the day at random times, e.g. 9, 1, 2 and 5, and how do you work when adding these? Is this for the GP Connect ones, you can select particular slot types, if that's regarding GP Connect, because this session is GP Connect.
Let's see if I can get that slide up for that. So when you're in the create session box here, instead of going to all slots GP Connect bookable and then just creating 5, you can't, in terms of the filter, you're not able to filter out which 5 of those slots will be available for GP Connect, but you could always just select the one at the start of the day, so 8 o'clock. You could highlight the one at 9 o'clock, 10 o'clock. If you just highlight those slots and right click and go into slot properties, you'll have this box pop up, and just tick that box, and then you can select as many as you want or as few as you want for that, and at different points of the day.
Thank you. Just trying to get round to some of these questions, if we've got any more. If we don't get around to your questions verbally now, it is something that we will be sending out and get back to you after this. You may have already had a private response for some particular questions, and other questions are being published into the Q&A box as we are going along. So just seeing if there's any more that we can come to now. I don't think we've got any more new ones. When we look for our external appointments, our local extended hours appointments aren't showing they use TTP. Sorry, that's not a GP Connect question, is it? That's something. Oh, so we'll come back to that one. Have we any more GP Connect questions here? So I've got one for, if GP Connect has been enabled on an EMIS community system, would these be viewable alongside the GP record? It is not available on the EMIS community system at the moment. It is just the GP primary care. So I think we are, oh, we've got. So we have 3 practices in a PCM who have sharing agreements for cross-org appointments. Could they use GP Connect? So yes, you could use GP Connect for booking appointments. It is something that's rolled out across all primary care estate in England on the spine. So it depends what you want to use the cross-org appointments for. As you've already got the cross-organisation sharing agreements between them 3 practices, GP Connect doesn't just need to be held across that PCN. So it depends what you're defining your sharing agreement appointments to your GP Connect appointments are. Yeah. So I think, like I say, if we've not come around to your question on this live section here, we will be getting back to any particular questions and publishing them after the event.
Yeah.
Brilliant. Thank you very much, Nathan and Catherine, for running that session. I hope that everyone online found that useful. As Catherine said, you know, if any questions flow in at the end, or we've not kind of covered them off, we are going to be sending around an update. So I think you should get an email next week that will have the recording of this and slides, and we'll kind of have a bit of a FAQ off the back of this as well. So hopefully you found it useful. We'd love to get some feedback, so that'll come around in that email as well. And have a great day, everyone. Thank you.
Thank you.